I think we all got very conscious of it when we were wearing masks all the time. You know, because why? Because you knew that you were not getting fresh air in and out, and that your breath is becoming dry and stale. Bottom line is, bad breath can affect any of us at pretty much any time. If you've ever noticed that you have bad breath first thing in the morning, and basically the definition of bad breath is an unpleasant smell of an exhaled air. So it's when you go and you actually can smell that. Now, not necessarily in your hand. I am going to tell you how you can actually assess bad breath, because the tool of choice for actually measuring exhaled air, oral malodor, bad breath, halitosis, whatever you would like to call it. Oral malodor is the term at the minute, the end term at the minute. And the way of actually measuring it without a halometer is actually using your nose, believe it or not. So I'm going to come back to that. But what you can have is this morning breath, which is short term. So bad breath can sort of last a relatively short space of time, and it's because overnight your mouth has become dry, because your saliva doesn't flow the same way. It almost dries up overnight, so your mouth can get very dry overnight. And if you mouth breathe, or snore, your mouth's getting even drier, because you're just pulling air in and you've got nothing to moisturize that. So when you get up in the morning, your mouth can be a bit of a hoo, and that can go very quickly, because once you start moving around, chatting, your saliva starts to moisturize, and this even without brushing your teeth, that will reduce. So you can have a short-term transient sort of bad breath issue. But what you can also end up with is a much more problematic, and I think something that people worry about much more, is a chronic bad breath. And that can sort of be related to a number of different things that we're going to look at. But what you have, the most common things sort of affecting bad breath, which most people will know about, are food stuff. So, you know, the old garlic and onion thing. So I often get people who I'm doing face-to-face consultations with, and they say, I'm really sorry, I've just had garlic for lunch, or I've just had an egg and onion sandwich. And when we've got masks and things on, we don't actually notice it. And to be honest, I have the most horrendous sense of smell. So, you know, I'm not an awful lot of use to you on that one. But chronic bad breath, the majority of the problem comes from your mouth. So 90% of bad breath problems, and I mean, that statistic varies slightly, anywhere between 70 and 90%, comes from the mouth. So it comes from inside your mouth. So you've got these groups of bad breath. So this sort of issues that come from the mouth, and then there's maybe about 10%, or maybe a little more than 10%, that come from some other source. So it might be an illness, it might be some other part of your body, and we're going to look at that. And you know, there is also a term that is used that you may be familiar with for people who really worry, this halitophobia. They really worry they've got bad breath, but they actually don't have bad breath. And I have met a number of people over the years, and we have a number of clients that really are very, very stressed about this. And it's something that they need professional help with. So it's something that's worth taking on board, that some people are convinced they've got bad breath, but actually realistically haven't. It's a bit like a fear of spiders, that, you know, it's not always as rational as it should be. Not that I like spiders either, but it just gives you an idea that there, some people get so focused on this that it can be really hard to reassure them that actually their breath is not it's not problematic. So that is worth remembering. How do you know? Do you know if you've got bad breath? I mean, how actually do you know? How do you actually measure bad breath? How do you tell? And the sort of thing your best friend will tell you about. Keeping that in mind, there are a number of things. I mean, people talk about the wrist test. You lick your wrist and then you smell it. You sort of hold your hands together and you breathe into it, and all sorts of random things like that. And there is actually a technical gadget that's used in research, this heliometer, that is actually measures the sulfuric, the gases that are coming out of the mouth of exhaled air, and it can be exhaled through your nose, exhaled through your mouth. But the primary reference standard point, believe it or not, for the detection of oral malodor is actually the human nose. So while all these other things are there, it's actually the human nose. What you can do is sort of scrape the back of your tongue and there goes my spoon. So you scrape the back of your tongue with a spoon or a tongue scraper, leave it for about 5 seconds, and then smell it from about 5 centimeters. If you've got a friend that you can trust and who is up for it, you exhale, and you ask them to be about 10 centimeters away from your mouth as you exhale the air, and they can actually smell from there. And believe it or not, the people who research this have professional odor people that actually, they use their nose. They're very, I suppose it's a bit like perfume and cosmetics people that have smell wines and things like that. They've got really, really sensitive nasal buds, and they actually will do that smelling and adjust, assess that. So I say there's a number of ways of doing it. The other thing, and I often find this with people, is using a bit of floss or an interdental brush, so that you use that and then you actually leave it for 5 seconds and you sniff it. And a number of times I have used an interdental brush on somebody or floss somebody's teeth, and they've gone, oh, that's awful. And it's not cognizant that that actually is something that they could do for themselves. So there are a number of things that you can give yourself an indicator of bad breath. And then, of course, is the thing that somebody actually says to you of bad breath, and that can make you really stressed, particularly if you don't know where it's coming from. And with that in mind, there was a big study that was just published, actually, I think it was Monday or Sunday or Monday. It was coming up to Valentine's Day. Anyway, it was an American study. It used 2,000 people. And what they did was they actually looked at how much do people know about bad breath. And the top of the list was the bad breath was the turn off for partners and relationships. 52% found it the biggest turn off when they were meeting a new partner. That was above body odor, so above BO, and above having a good sense of humor. This was the biggest turn off. So if they had no sense of humor, you know, if you had fresh breath, you know, you might have been onto something. You know, again, likewise, it was a bigger issue for them than being overconfident. So it was quite interesting how that actually broke down. And there is an impact with this. There's an impact of bad breath, and there's an impact on our lives, not just you know, oral health wise, because it can affect your oral health, but very much in relation to your self-confidence. Because if you're worried about that and you're stressed about having bad breath, that can have a big impact there. And I mean, your relationships, we've already said, and that can be from sitting close beside somebody in a workplace, or caring for someone. And again, you know, sometimes in hospitals, and particularly sort of close to end of life, people get a very, very strong odor from their breath. And again, it's about comfort and being able to say that final goodbye to a certain extent. But the things that upset people in this study was they were worried about dates, so again, relationships there, and interviewing for jobs, so actually being face to face. But you know, if you're working in an office environment and you're sitting across from another person who suffers oral malodor, that can be really unpleasant. Likewise, if somebody has body odor, it's the same basic concern. What amused me within this study, only 16% of them were concerned about bad breath when they go to dental appointments. So I think it was just presumed maybe that dental professionals were sort of, well, that was their environment and they took what they got. I mean, it just was one of those things that sort of amused me in my very warped sort of brain, as you all know what my brain's like. Going on with that study, one of the things that they said was they didn't know what caused bad breath. They had bad breath, they worried about bad breath, but they didn't know actually what had caused it. So I thought we'd have a wee look at the potential causes of bad breath. Many people don't actually know what causes it. They sort of assume that it is food, that 41% of this same study of these 2,000 thought it was food. 36% thought it was bacteria. So there were some people had an idea it was something to do with bacteria, not necessarily knowing where the bacteria came from, but bacteria. 35% smoking. And again, I think as smoking has become less popular, less socially acceptable, smelling of smoke, whether it's your breath or your clothes, again, is one of those things that people sort of sit up and go, not so fussed on. Dry mouth, people don't necessarily know how your mouth being dry contributes to bad breath. And that's when your mouth is dry, the bacteria and the biofilm multiply more rapidly. You get a thicker, more tenacious, stickier biofilm, which is actually harder to remove. So keeping your mouth moist is really important, and hydration. And I mean systematic, sort of your whole system retaining being adequately hydrated is really, really important for that. And some people did actually mention sulfur gas. Okay, so what we talk about in relation to bad breath, where the smell comes from, is often what we call volatile sulfur compounds, and that's how do these volatile sulfur compounds actually develop. So those volatile sulfur compounds develop from a number of sources. The most common one is the volatile sulfur compounds coming from the plaque biofilm and the oral bacteria in your mouth. So the biofilm forms on the surface of your teeth, in particular around the gum margin, a little crevice around the neck of your teeth and in between your teeth. And what happens is the bacteria that live in your mouth colonate that biofilm, and they develop and they mature in that biofilm, and they need a stable biofilm to grow and get up to their trouble and cause you hassle. So what you want to do is keep breaking down the biofilm. That's why I go on, everybody that runs my professionals the world over go on and on about how important it is for you to control your biofilm in your mouth and actually manage your biofilm, because that can help create a healthy microbiome. I think people are much more aware these days of gut microbiome and having healthy gut bacteria. Well, what you want to do in the mouth is have healthy oral bacteria, so that your good bacteria help control the bad bacteria, and they keep that nice ecosystem in your mouth healthy, and that will also help from a fresh breath point of view. Consequences then. We said the consequences can be dire on relationships, and it can be not just partners, it can be adult children. We often get parents asking us about their child's bad breath, and I have to say I do cringe when a parent asks me in front of the child, particularly if the child is old enough to be cognizant of what a parent is saying, because that can very much then play on somebody's mind. It plays in any of our minds. If anybody has ever said to you that, oh, your breath's not the greatest, it will start to play on your mind, and you can get slightly paranoid. And children are really no different, but children do get oral malodor, and it can be related to a number of things. But microorganisms and raw microorganisms are nearly always in there, because 90% of the problem comes from the mouth. The other 10% come from elsewhere, but the majority of problems with oral malodor come from inside your mouth. First one, and it seems so simplistic, is poor oral hygiene. So, and I've missed an I in there. Apologies for my spelling. Poor oral hygiene. So actually not disrupting and removing that plaque biofilm regularly enough and effectively enough to keep your mouth not only healthy but also fresh. So that comes into it. Cavities. So if you have got a big gaping hole in a tooth that maybe has even developed a chronic abscess, so if you think if you have a boil in your face and it doesn't actually burst, or partly weeps every so often, never really heals up. You know, you've got that infection going on in your mouth, and that's not good for your health. It's not good for your teeth. It's not good for a whole lot of things. But gum disease is another one, and gum disease in particular, because what we know about gum disease is where you develop these gum pockets, so the space between the gum and the tooth. So Talking Teeth Thursday, I did about single tufted using cleaning gum pockets. It's on the YouTube channel if you can't search for it on Facebook, and that's worth showing, where I actually show how you can clean into those gum pockets. But gum pockets are a great place for plaque biofilm to develop undisturbed, because with the best will in the world, unless you are using a long, slim brush that goes down more than a couple of millimeters, nothing really penetrates more than a couple of millimeters into that little crevice at the neck of your teeth. Dry mouth I've mentioned. Tonsil stones, often get asked about tonsil stones, and I've got an image about them, a little bit more about them, I think, on the next page. But tonsil stones, if tonsil stones break, they are really rotten, and it's just condensed little bits of bacteria that have lodged in the pillars of your tonsils, and they can break away. Now, there are ways and means of removing them, but some people have chronic tonsil stones. I've known people to have their tonsil removed to get rid of the tonsil stones, but they really are unpleasant if they break open. They can be quite large. So as I say, I think I've got a picture of some coming up. Tongue coating. The dorsum of your tongue, so the surface of your tongue, that back, the posterior third of your tongue, is really, really prone to bacteria gathering on that. And that bacteria and the biofilm, because plaque biofilm develops on all the surfaces in your teeth, and your gums, and on your, you know, if you've got a denture, if you've got implants, plaque biofilm develops on all surfaces of your mouth. But on the coating in your tongue, you've got little filaments that sit in the surface of your tongue, and the bacteria lodge in underneath that, and then they break down and form these volatile sulfur compounds that then let off this gas. And the posterior third of your tongue is the bit that actually gets most of that. So how do you actually remove that? We're going to come to that. Thrush, so infections in your mouth breathing because it dries your mouth dry, bacteria biofilm multiplies more rapidly, and that's where that comes from. Unclean dentures and appliances. It still amazes me how many people do not clean all dental appliances. So if it goes into your mouth, it needs to be cleaned. Dentures, yes, now dentures should be left out at night, they should be cleaned thoroughly with soap and water, or better still, I mean, it's something like the hygiene, which is just great for cleaning any sort of appliance. It's quick, it's easy, it has got a really effective dental cleansing gel comes with it, and in my mind that is totally my go-to now for any sort of dental appliance. So appliances need to be cleaned. If you've got food packing in and around your teeth, and where's my piece of cheese gone? That's exactly why I was talking about my piece of cheese, because if you have ever left cheese in the back of the fridge and you have found it at some later date and it's all gone a bit blue, basically that's what's happening in your mouth. So if food has been left in the back of your mouth and it started to break down, it basically becomes moldy, and believe me, it's not going to smell too good. So it's worth remembering that actually when you don't clean your teeth thoroughly or effectively enough and regularly enough, bacteria will break down, and if there's food there, that'll happen. It will break down the food as well, and particularly sugary things. There's some things that will break down more rapidly. Per salivary flow, dry mouth, we've mentioned. Acid environments in your mouth, and particularly if you've got any sort of gastric reflux. So anybody that's got reflux, you may well find that actually aggravates your mouth. When you've got reflux, number one, you've got this really, really low pH acid coming back into your mouth. You're finding that you haven't got a healthy gut microbiome, never mind a healthy mouth microbiome, and you think it's a straight tube up and down, so it's going to have an impact then. Things that then actually have an effect on top of that are things like smoking and vaping. Yeah, both have a very drying effect. Alcohol, very drying effect, and alcohol has been strongly, smoking and alcohol have been very strongly linked, not just with dry mouth and oral malodor, bad breath issues, but also with mouth cancers. So as I said, really important you know, keep all these little things in mind, because there's never just one thing that actually comes into interacting here. And the bits you want to be aware of when you're cleaning, that posterior third of your tongue back there, in between your teeth, and in at the gum line, just that little crevice around where the gum and the tooth meet. There's a little crevice there, and you've got to get your bristles just in underneath that crevice. So you need to put a little bit of pressure on your toothbrush bristles. If you have a power bristle brush, the power does the work for you. You just need to set it in place, whether it's sideways or round, whatever way it does. But then you need to have enough pressure on it, the bristles engage. You're not scrubbing the floor, so gently, and then move on. Whereas a manual brush, you need to make those bristles actually work for you. You need to move them. As I say, about 10% of oral malodor comes from your mouth. So what about are the other options? So what are the other possibilities? So in other words, you're doing all the right things. So you're maintaining moisture in your mouth, you're drinking plenty of water, so you're adequately hydrated, that you don't smoke, that you only drink alcohol in moderation, and your oral hygiene is like A+. You're doing all that and you still are worried you have an issue. I mentioned the gut microbiome, I mentioned a little bit about tonsil stones, and that's a relatively big tonsil stone there, but they just tend to pop out at the back. Some people, you know, don't even know they're there until they finally think it's a bit of tooth and it's been a tonsil stone. What about the other possibilities? And these should never be your first port of call if you've got bad breath. Your first port of call should always be, what is the most common cause of bad breath? And that's stuff coming from your mouth. So that first port of call is where you start and you work from there. But if you've got a chronic sinusitis, or you've got mucus, so you've got catarrh, you've got a postnasal drip at the back of your mouth, and you've got polyps, you've got chronic tonsillitis, tonsil stones, those could all contribute as well. Okay, and those need to be addressed if it is causing big problems. Like anything to do with your health, that, you know, you can't just ignore it. Or sort of serious things, because I mean, bad breath isn't just a social issue, it can also actually be a health issue. So there's lots of bronchial and lung infections. So if you think about COVID and why their oral hygiene was a big deal for people who were actually being nursed in COVID wards, because the potential for aspirated pneumonia, and it was bacteria going down into their lungs. But likewise, you know, you can get this exchange that actually can give you a bad taste and bad breath. Gastrointestinal issues, so things like irritable bowel syndrome, celiacs, Crohn's, all affect your gut microbiome, and that actually can be a contributing factor. Helicobacter infection, again, that can be another thing that's actually been shown to have a relationship with oral malodor. Likewise, gallbladders, constipation. There's lots and lots of things that actually just impact the potential for actually causing oral malodor. So if you have got a problem and it's not being resolved, you want to actually address it. There's some more unusual things. So metabolic dysfunction. So if you're diabetic, if you've got high blood pressure, if you're obese, again, and we know obesity and increased weight has a very negative effect on so many aspects of our life. Kidney failure, certain carcinomas, so certain types of cancer. All these things can actually have an impact on your breath freshness. So if you've excluded all the obvious, so in other words, you're doing all those things that I said about your oral hygiene's excellent, that you're drinking enough, that your mouth is not dry, you're doing all those things, and you still seem to have this chronic bad breath, go and talk to your doctor, your dentist about it, and just check that there's anything else going on, particularly if you're not feeling great, and particularly if you're not particularly well. And I mean, we know sometimes post-menopause, and women will get it, during ovulation, so at the time of their period, during their pregnancy and menopause. So again, it's that hormonal imbalance that can actually be a contributing factor as well. So there's lots of things actually can impact that lovely fresh breath that we all want and enjoy most of the time. Other things that people who are depressed, and particularly on antidepressants and neurologic disorders and medications, often those have medications that impact oral dryness, and you're back to that issue then with your mouth being dry. Bacteria multiply more rapidly, biofilm develops more thickly and it's more difficult to remove. So those things need to be kept in mind. The other thing about people who are depressed or suffering any sort of mental health issue is their ability, their motivation to look after themselves can be affected. So all those things can impact breath freshness, which you may not have thought about. Bottom line is bugs. And we don't particularly like bugs of any sort, whether they be the crawly 4, 8, 16-legged versions or the bugs in your mouth. Microorganisms, the bacteria in your mouth, the biofilm is a living community of bacteria. And those bacteria move around and they organize themselves. And like any little community, there's good ones and the bad ones, and they get themselves organized into little groups, and they look for opportunities to cause problems, and they will gather on anything in your mouth, be it a denture, a mouth guard, aligners, your teeth, your gums, your tongue, your soft tissues. It will build up on all surfaces in your mouth. And that is why, we go on and on and on about oral hygiene, because those bacteria move from being aerobic, so oxygen loving, to anaerobic, what they call gram-negative bacteria, and they are particularly located in the tooth surfaces, in the tongue, and in gum pockets. So if you have periodontal disease, your oral hygiene becomes a real game changer for you, particularly because they can break down into volatile sulfur compounds. And initially, when somebody has got a gum problem, their gums are very inflamed, they may also be very uncomfortable to clean and start to particularly clean in between your teeth. So you sort of have to work up to it and accept that it's going to bleed like mad. And again, bleeding in itself can cause a bad smell. So it's sort of, you've got to go through this phase of something that is relatively easy to use, and as the soft tissues heal, you can use something more suitable. So always cleaning in between your teeth, it's working with something that you can manage, that you're prepared to use every day, and then work up to the gold standard. And that can take some time, because if you're having gum treatment, the shape of that space in between your teeth will change as the soft tissue heals up. So different size brushes, different size tools, different types of tools will all come into that. Mouth guards, how often do you know somebody playing sports, and every time I'm watching the rugby every weekend, I'm looking at their mouth guards and thinking, I hope you guys are all taking those on, keeping those clean. Not always. Often mouth guards get thrown in the bottom of kit bags and don't get looked at again for another week. So check out the Dr. Mark's hygiene sport range, because there's stuff there that will help your loving sports player to actually maintain a healthy mouth guard, because as soon as you put it back in, you're just bringing the bugs back to play. Now, back to my cheese. Now, you wondered what I was doing with my little bit of cheese. Well, like comes the cheese again, and I have to say I might have this later on. It's very good because it buffers and neutralizes acids in your mouth, this cheese, so it's a great thing to finish a meal with. But cheese, imagine your teeth with cheese stuck between them, and you can't, or you won't, or you haven't cleaned in between your teeth. So in other words, you haven't used any intradental brushes, you haven't taken any floss, and all that stuff is in your mouth and it is doing its thing. And if you leave that cheese in the back of the fridge and totally ignore it and allow the environment in the fridge to do its business, what you're going to end up with is rotten cheese. And if you've come across something like that, you know how smelly it is. So that's where my analogy for the cheese comes, because if you leave food between your teeth, the bacteria will break down that food and they will just keep going, and they'll produce these volatile sulfur compounds and it will smell. So that's why intradental cleaning in particular is so important as a first stage to actually managing breath freshness. And the number of times that I speak to clients and they will want to do everything else except actually physically clean in between their teeth. People want a quick fix, they want a shortcut, and there is not a quick and easy way of breaking down and removing that biofilm. There's more effective ways of doing it. So when using power toothbrush instead of manual toothbrush, interdental brushes instead of floss in big spaces, there's different ways of doing it, but you physically still need to do it, or you need to get somebody to help you doing it. So when these volatile sulfur compounds break down, this is what they break down into. Now, hydrogen sulfide is the smell that you get from a rotten egg. I'm sorry if you've just had your dinner, it's really unfair of me, but methyl methylcarbon, all these things that I have, which I'm not very good at pronouncing, they all break down and they form about 90% of the putrid odors that come from your mouth. It isn't very much fun, to say the least. And that is why it is so important that actually we do actually stop and think sometimes, because what's going on in our mouths are these bacteria are developing, and they'll develop around the gum margins in between your teeth. And the first sign of inflammation in your gums are being irritated by those bacteria is that they get puffy, they get very red, and they swell up and they bleed easily. And I often suggest having a good look in your mouth. We don't often look in our mouths terribly. Get yourself a torchlight, bright light, and have a jolly good look in your mouth and see if you can see different tones, different shades of pinkness and redness around your gum margins, because that's an indicator that your gum margins may be inflamed. They may look a bit different. Now, if you put that with dryness, so in other words, you're not drinking enough water, you're not maintaining hydration, you're maybe a mouth breather, you're maybe on medications that are contributing to dry mouth, and that's one of the things you've maybe never had a problem with dry mouth, and then this develops that you get that sort of sensation that maybe your mouth is sticky, you need water when you're eating. All those actually contribute to creating this anaerobic bacteria that are involved in producing these volatile sulfur compounds. And those not only live in your tongue, the bacteria live in other parts of your mouth, but that posterior third of your tongue is really high risk for actually gathering these bacteria, because you can see down here, you've got these little papilla on the surface of your tongue, and you can see these little places that bacteria can lodge just on the surface of your tongue. And that's why tongue cleaning is a good thing to be doing on a daily basis. You do it part of your oral hygiene routine, clean in between your teeth, clean your tongue. Last thing you do is brush your teeth, spit your toothpaste down. Don't rinse out afterwards. Get the maximum benefit from your toothpaste. Now, the other thing, and this is just to a certain extent an aside, but the other thing about malodor is the cause of malodor. And again, spelling mistake. Sorry, typo. The cause of malodor may well impact your oral health. So gastric reflux, for instance, so the pH of your stomach contents is probably in the region of sort of battery acid. So it's pH maybe 2 or 3. Now the enamel starts to demineralize, so it starts to dissolve when the pH drops from neutral at 7. When the pH drops to 5.5, the enamel will start to dissolve. Okay, and the saliva comes along and remineralizes and heals whatever acid attack on the teeth. Now, the dentine, so if you've got root surfaces exposed, if the dentine is exposed and the root surfaces, the pH does not need to drop as far as 5.5. It only needs to drop as far as 6.4. Now, if you're talking neutral pH of 7, 6.4 isn't that acidic. Now, if you've got gastric reflux, so you've got a pH of 2 or 3 coming into your mouth, particularly the back of your mouth, that can then cause acid erosion in your teeth, and it can lead to sensitivity. Dryness, your mouth is dry, you're losing that buffering capacity that saliva gives you with calcium phosphates, and that can increase your risk of cavity tooth decay. It tends to be more rapid plaque development and more gum inflammation, and also it's really easy to traumatize the soft tissues. So it's when it's very dry, it can be fragile, friable. So I mean, it just a slight catch can split it. So if your lips are usually moist and then they get cold, they get very dry during the winter, and it doesn't take an awful lot for them to split and bleed. Likewise, the internal surfaces of your mouth, when your mouth is dry, it's very easy if you catch yourself with a toothbrush or when you've got a dry piece of toast, something like that, to actually cause trauma, which will ulcerate and be blooming sore. And always keep in mind, you know, ulcers, any ulcer, any red or white patch that's not healing in 2 or 3 weeks in your mouth, anything that's bump, odd, this just wasn't here 2 or 3 weeks ago, get it checked out by your dentist or your doctor. Really important, because mouth cancers, we're seeing more of them, and it's not just those heavy drinkers and smokers who were classically those people we worried about maybe 15, 20 years ago. The human papillomavirus, which was mentioned in the news this week, the HPV virus, is a major contributor to mouth cancers. So check your mouth every month. This Tuesday comes checkup Tuesday, so make sure you're following Growing Smiles, and you'll always get a reminder. We're going to do, well, number one, you want to identify the cause. Where's it coming from? What actually is causing this? So do you drink a lot of alcohol? You know, do you smoke a lot? I mean, are you eating certain foods? So if you've just had cheese and onion crisps, and we all love potato in this house, and if you love cheese and onion crisps, well, do you know something? Your breath's going to smell like cheese and onion for a wee while, you know. So that's a transient thing. It's not going to be very long, and that's one thing. So on the other hand, if this is an ongoing thing, we're a different ballpark. But identifying the cause, you may well be able to identify it yourself. Now, if you have tried and you can't pin it down, you still think you've got a breath issue, you know, speak to your doctor, speak to your dental team, ask them what they think, and they should be able to then point you in the right direction and actually see if they can help you. It might be, you know, even checking something as your blood sugars and realizing you're pre-diabetic or diabetic. It might be something like that, you know, which is a serious illness, and you want to address that. So reflux, there's all sorts of things, but you want to identify the cause. That's the really important thing. Then what you want to do is work out what's going to be the treatment, what's going to be the management for that oral malodor, because often it is going to come into the boundaries of treatment and management for other things going on either in your mouth or in your body. So some of the things that they might look at doing is professional cleaning. So they call it these days professional mechanical plaque removal, or I like to say professional mechanical biofilm removal as being technically more accurate, but who am I? And you know, if your gums are bleeding, you know, you want to have gum disease treated. And we know gum disease is such a strong link with other illnesses in your body. So things like heart disease, stroke, diabetes, rheumatoid arthritis, chronic kidney disease. There's a ream of inflammatory conditions that are related to gum disease. So getting your gum disease treated, your gum health on top, will also have benefits elsewhere. And diabetics often know that they need to get their eyes checked, they need to get their feet checked, but you really need to get your mouth checked. So if you know somebody, or you have yourself recently been diagnosed with diabetes, please get yourself a dental appointment and tell the dental team that you have diabetes. And that's one of the reasons it's so important that when you go to your dentist, you actually give them a really comprehensive medical history, not just the things you think they need to know. It's all those other bits in between, because they're trying to work out not just what they're seeing in your mouth, but they're trying to work out why they're seeing it. And then they can best offer you support and treatment for that. There's a technique that is becoming sort of the new way of managing gum health and biofilm in a professional environment. And that's a technique called guided biofilm therapy. And if you haven't heard about it, go look it up. It's basically powder and water under pressure with a medicament of the powder. It's erythritol, and what it does is literally disrupts the biofilm, and it's really effective. And the erythritol also has a benefit for anybody that's high risk of tooth decay. So as I say, there's a number of ways of going about it, but having gum disease treated is really important. And I think going forward, we're going to see more and more dental practices adopting a greater holistic approach to oral health and overall health and well-being. I mean, it's daft not to think of your mouth as part of your body. I mean, we just don't chop you all off at the neck and look at you in isolation. So what you want to do is control the symptoms. So these are the things we can do for ourselves. So by and large, we control the plaque biofilm ourselves. Now, that changes how easily we find that throughout life. So if your dexterity is limited, or you struggle to keep your mouth open, or you are on multiple medications, you know, the challenges of maintaining effective plaque control fluctuate. If your mouth is dry, you might need to brush more frequently. Removing the tongue coating, so that you can do that with the tongue scraper. Tongue scraper is the most effective thing. This is the TP tongue scraper, and there's little ridges on that tongue scraper, and from the back forward. And I think I do have quite a gross video on the YouTube channel of me cleaning my tongue after disclosing it, and you clean it from the back forward. If you don't have a tongue scraper, you can use your brush. Tongue scrapers, science tells us tongue scrapers are more effective. The other thing you can use is an inverted teaspoon. Not if you're about to stir your tea, but teaspoon, back of your mouth, and bring it from the back forward. So you're doing it, if you think how a JCB goes, the digger, pulling things back, don't scrub up and down, because you remember the little filaments in the surface, you can actually traumatize them. And we don't want you hurting yourselves. That would definitely never do. If you're a mouth breather, so what you're trying to do is control these symptoms. Oral hygiene is one thing. Reflux, diabetes, get anything like that treated. Mouth breathing. Why are you mouth breathing? Have you got a totally blocked nose, so deviated septum? I mean, have you had your nose broken? Is there some reason, if you polyps there, you cannot physically breathe through your nose? Is it habit? And there's a lot moving forward about improving our breathing techniques so that we actually are nasal breathing as opposed to oral breathing, because it's actually better for us to breathe through our nose than it is through our mouths. Is it because your teeth don't close, so your lips actually physically can't get closed together? And if that's the case, I mean, orthodontics might help that. So it's always worth talking about the mouth breathing, and see sort of why, and can you do something about it. The tongue coating. Keep your tongue nice and clean, eat varied diet, so plenty of fruit and veg, drink plenty of water, will all really help in that. And if you think of what the things that hold your teeth in your jaws, what we call the periodontium, so the gums, the fibers that hold the gum around your tooth and go into the bone, and the bone, that's called periodontium. And for healthy periodontiums, there's connective tissues. They need those little micronutrients, those vitamins and minerals that we get from eating a healthy mixed diet. So really important. Good toothpaste. Fluoride is like pretty standard. And then there's other active ingredients that you might want to look for if you're concerned about bad breath. And I'm going to mention those to a certain extent when I sort of mention mouthwashes in a minute. And there's things like chlorhexidine, there's zinc ferrets, there's chlorine dioxide, and those would be the sort of most common ones. But some of them really are for only short-term use. And I would only ever really bring in a mouth rinse when all the other stuff is being done really well and we're still not winning. So it's doing enough to get your mouth healthy. And then a mouth rinse is an adjunct. It's an extra layer. It's that extra level of care. And if you notice the social media on Growing Smiles last week, I think it was last week, I can't remember, we talked about mouth rinses as being that little extra. It's not an alternative to doing the basics well. Really, really important to remember that. Sugar-free gum with xylitol. Now, xylitol is very clever. And those of you who know me know I'm a big fan of xylitol. Xylitol is like the younger brother of erythritol, which I just mentioned in the guided biofilm therapy. It's sugar alcohol, and it stops the bacteria that cause decay sticking to your teeth. So it's fairly clever stuff. Xylitol comes from the birch tree. It's a natural product. And erythritol and xylitol both have similar properties. Erythritol does it slightly better, hence it's actually more expensive. But xylitol is one of those things that is really useful to have in your mouth. So you'll get toothpaste that has xylitol, and mouth rinses, you've got chewing gum, you've got various sweets of xylitol and erythritol. And if you've looked at any of our Dr. John's range of sweets, they have now shifted nearly all their range into erythritol as their sweetener. And we've just got a new pile of stuff landed there. So anybody that loves the Dr. John's treats, you can go and have a look. Sugar-free gum is great. Not just even take the xylitol out of it. Chewing sugar-free gum stimulates your saliva flow. And I'm not going to go back over all that I said about saliva. We know how important saliva is in our mouths. But then you do all that and you're still concerned, or you still realize that you actually do have problems. Definitely get your gut checked out, get your health checked out, and you may then want to add in an alcohol-free mouth rinse, alcohol-free because the alcohol has a drying effect, and then look for active ingredients that have actually been shown to do some good and be effective for controlling oral malodor. By and large, most of these things are transient. They don't have a long-term benefit, but it might help over a period of time to shift that microbiome, shift that bacteria into a more healthy environment. There it was, I covered the probiotics there. The probiotics, again, it's about shifting your microbiome. So you've got a healthier microbiome. So the good bugs then help to control the bad bugs. And the probiotics, we stock, those probiotics actually have been shown, scientific evidence that they do have benefits for people who have serious problems with oral malodor. Bottom line, this is not rocket science, and you knew I was going to come to this because I'm a creature of habit. Personal daily oral biofilm control, and it's doing the basics well, and the basics aren't boring, so you're talking about interdental cleaning. Clean between first, clean your tongue, then do your toothbrushing. That's my basic order of play if you're doing the whole lot at one go. Don't get bogged down with doing it all at one go. It's more important that's happening every day. The toothbrushing, last thing at night, one other time in the day, so twice a day at least. Brush it more than that if you want to. If you've had an acidic challenge, whether it be gastric reflux or you've just had a load of citrus fruit, don't go brushing your teeth immediately afterwards. Leave it for a good half hour, an hour, to let the saliva help to remineralize. Otherwise, what you're doing is you're scrubbing on a softened surface, and you can actually get tooth surface wear. So you don't want to be sort of trading one thing in for another. Toothbrush, round the gum line, every surface of all teeth, and that takes time, and it takes a certain amount of patience. Use your toothbrush dry, and if you're not sure what you're trying to clean off, disclose the plaque biofilm. Now, disclosing tablets have been around for years, and a lot of people know about it. What you may not know is the new kid on the block. Wonder what I did with it. Oh, there we go, how to lift it out. Is this stuff here. So this is Plaque HD. It is not cheap. I am the first one to say it is not cheap. It's an American product, but it is toothpaste that you can actually use as a toothpaste. So you don't need to have that two-stage of disclosing first and then actually brushing off. You can use this actually all at one go, brush away, spit the toothpaste out, don't rinse. It has 1450 parts per million fluoride in it, so it's exactly what we'd be suggesting as far as a high fluoride toothpaste goes. So as I said, it's sort of pretty much one of the new things that we've had recently. Cleaning in between your teeth, use something that you can use, that you're happy using, and that actually fits. Size really matters, and if you're not sure, speak to your oral healthcare professional, speak to us, we're here to help. Drink more water, and if I speak to, I would say, a dozen people nearly every week, one of the things that will always come up is their hydration levels and the fact that they're just not drinking enough water. And if you're not a water drinker, and there's a certain generation amongst us, myself included, who were not brought up on drinking water, and I would be little ones drinking their little bottles of water all around the place. Trying to get yourself to drink enough water and not spend half the day in the bathroom can be a bit of a challenge. I often suggest start with a really small glass. I mean, like a shot glass size, or even an egg cup. Plonk it beside the tap in the kitchen. Every time you go past that, have that small cup full. Just run the tap, cold water, and drink it. And keep doing that, and gradually get a bigger glass. And do this over, I'm not talking over increasing it over the day, I'm talking over doing it 2 or 3 weeks. And you will get used to that. Cold water, my mind, I like cold water much better than I like lukewarm water. So either stick it in the fridge or just let the tap run. But it's cheap, it's accessible, and it is incredibly good for you, because dehydration affects us in so many ways, whether it be our skin, our hair, our mouths, our systems, everything. So drinking plenty of water is really important. Interdental brushes, as I say, size matters. It's got to be done. You want to find something that you like that you can use. And don't forget, if you're using interdental brushes, it doesn't always have to go from the outside in. It can come from the inside out. And if you're struggling with that, there are lots of aids that can make things easier. So either a long handled brush or a water flosser, there are different things that can be used depending on your level of dexterity. And again, that changes. So worth remembering. Mouthwash and electric toothbrush. Electric toothbrushes, we know, clean more effectively than a manual toothbrush. They don't do it faster. That's always the thing that people think electric toothbrushes do it faster. They don't, they do it more effectively. All you have to do is plunk it in place, let the bristles do the work. Bottom line is, do you have oral malodor? Do you have bad breath? Do you know if you've bad breath? Is it something your best friend would tell you? Good question. Be brave. Ask. Get somebody to go the whole hog and actually get them to stand in front of you while you breathe out, and their nose is here and they sniff while you breathe out, and find out. Now, don't do it first thing in the morning, because we all wake up with morning breath, but you want it after you've been actually doing some things. You've maybe even had your breakfast, you've had a cup of tea or whatever it is, and you've been moving around and chatting. But why do you actually have it? That is so important. It's identifying the cause. If you can identify the cause, then you can work out what to do about it, or at least get yourself directed as to where you're going to go. Then you need to look at the treatment. So what actually is the treatment? What is going to work for you? Now, basics are always sort of, what can you do for yourself? What do you need to approach a professional for? Do you need to get in professional involvement, professional advice and guidance? And it is a very regular question that comes to Growing Smiles. What can I do about my bad breath, or I think I have bad breath? And often it's getting those basics right. So, you know, it's somebody that's never really cleaned in between their teeth, and for some reason something has changed, that the microbiome was changed, and all of a sudden it is now breaking down into volatile sulfur compounds that is giving them a bad smell and a bad taste. So you do what you can, you control what you can. Apply biofilm, you can control your smoking. And I mean, it's dead easy for me to say, never having smoked, but quitting smoking is not easy. And it's something that you need to get support with. And there is plenty of help out there. The NHS website has some really good tips and advice about cutting back and quitting smoking. And if you are going to vape as a route to quitting, we know vaping is better than smoking tobacco or using tobacco, but you want to actually ultimately get off that as well. Alcohol use. Alcohol, I think it's something that increased quite dramatically during COVID, because people were at home, and many people were using it as a support of one way or another. And it's been quite hard for some people to actually wean themselves off of having those couple of drinks every night. You know, alcohol, we know any alcohol is not great for us, but your alcohol limits are maybe not nearly as high as you think they are. One drink does not mean 1 unit. Look at DrinkAware or the NHS website again, and actually see how much alcohol you're consuming, and how are you drinking every day, and are you binge drinking? Because again, that has an impact. And I mean, it totally dehydrates you, and as I said, what I mentioned earlier on about increasing your risk of other things. Food selection, can you do something about that? Well, you know, maybe I'll not have egg and onion sandwiches when I'm going to be sitting right beside somebody in an enclosed space for the next 2 hours. I'll maybe be a bit more considerate. Or what'll I have? Cheese? Maybe cheese doesn't smell so much, not when it's fresh. And then you want to seek professional advice for the things that you can't control, or the things that you need help and support with. We're here always to help. So if you don't know who else to ask, come to us. Come to us. But sucking mints, swishing your mouth 50 times a day with mouth rinse, all it's doing is masking the odor for short term. If you get half an hour out of that mask, you'll be doing quite well. It is not an alternative for addressing the cause of the whole issue. And that's why it's so important. If you're worried about bad breath, talk to somebody. You may find your dental practice has a fresh breath clinic. And there you've got people who are really interested in this area of dentistry, and they will be able to offer appropriate support. Having your teeth professionally cleaned also means then that you are going out with an environment that's conducive to health, that all you've got to do is maintain it. So it makes controlling your plaque biofilm on a daily basis easier. So I'm going to leave you with my monkey cheese slide, because that's basically all I've got for you tonight. I actually quite enjoyed that one, which is really, I don't know, I should admit to that, should I? But if you are thinking of skipping your interdental cleaning tonight and cleaning your tongue tonight, think of what happens to that food that is lying between your teeth, because the bacteria in your mouth are just prepping for a party, and they're going to party in your mouth, and they're going to poop acids, and they're going to cause irritations, and it'll not happen literally overnight, but it will happen relatively quickly. So listen, folks, that's all I've got for you. Thank you ever so much for joining me this evening, or whenever you actually get around to looking at this. But until next time, from your best brushing buddy, good night. Look after yourself, and don't forget to brush your teeth before you go to bed tonight. Thanks very much. Bye.